Do you have any sort of, after somebody came to me with excruciating pain, how you would deal with that straight away? It's
treat the person, not the problem,
yeah.
first of all. But I use Trepanolol quite a lot. And I started using Trepanolol when I was asked to treat somebody for a combination of fibromyalgia and chronic myofascial pain. Fibromyalgia is a central nervous system disorder which sends signals to the musculoskeletal system to pull the body out of shape. So this guy came in like that. And chronic myofascial pain, the myofascia is that kind of, if you pull the raw chicken apart, you know the membrane, the translucent membrane that sits across the muscles. That's the myofascia, and it has a lot to do with the transmission of pain signals. Anyway, he had them both. He'd had £80,000 allegedly of physiotherapy for the fibromyalgia. So, and he was in agony all the time. And it didn't help putting him on the couch, because I don't think it was the right shape for him really, although it's quite popular with most people. And he said, I was about to start treating him, I don't know what I was going to do, and he looked at me and he said, I wish somebody could just give me an injection and take the pain away. I said, haven't they done that then? He said, well, I've had injections, but I've never had anything to take the pain away. And I said, well, I could try giving you a shot of Trepanolol. Trepanolol was something I just invented in my head. He said, will it work? I said, well, it's worth a try. You never know. See how your body reacts to it, but we'll give it a go. Give you a shot of Trepanolol and see if that takes the pain away. So I hypnotized him and injected 5 millilitres of Trepanolol into his carotid artery, only it was the wrong side of his neck for his carotid artery, but he wasn't going to know that. I performed the injection using a Thomas the Tank Engine egg cup, into which I dispensed a small quantity of Sainsbury's antibacterial gel, which I swabbed onto his neck with a Johnson's cotton bud, and then used the pointy end of an electrical screwdriver, the other end of which serves as a tap sometimes, to give him 5 Trepanolol. 1, 2, 3, 4, 5. And when I woke him up, he said, how long will this last? And I said, well, maybe a month. And he said, a month? I was hoping you'd say for the rest of the day. Really? A month? I said, well, I don't know. I mean, we'll have to see how your body metabolises it, how you get on with all of that sort of thing. But anyway, we made an appointment for a month later. He came back a month later, like this. I said, how's it been then? He said, it was great until yesterday. I said, oh. He said, yeah, best month I can remember. But the pain came back yesterday. I said, I'll tell you what, we'll give you 10 Trepanolol this time. See you again in a month. The 10 mil will carry you over, so you'll have a month pain-free. So hypnotised him again, Thomas Tank Engine egg cup, electrical screwdriver, 10 Trepanolol. Woke him up, bliss. Off he went, came back a month later. How are you doing? He said, the pain came back yesterday. What? Pain came back yesterday. Bugger. So I tried giving him, I don't know, 3 months, or whatever I did, the pain came back a month less a day later. And I think what happened was that his subconscious was so, or some part of him, was so relieved to get the month less a day's worth of relief from the pain that it didn't want to risk it by being greedy. It didn't want to go for 2 months and risk sacrificing the month it knew it could have. So that was where we stuck, and I see him for 10 minutes, one lunch hour, every month, and have done for years and years. He's upright now. He's vertical. And he's unwound, he doesn't have the fibromyalgia. He gets twinges the day before he's due to come and see me again. It's probably become a self-fulfilling prophecy now, but he's happy with the situation. I don't charge him, he's only there for 5 minutes. And he knows it's a Thomas Tank Engine egg cup with an electrical screwdriver. That's fine.